Good afternoon, everybody. My name is Jason Weber. Hopefully you can see the slide. I'm the sales director for Medicare Supplement at Mutual of Omaha, and AmeriLife was kind enough to give me an opportunity to get in front of you guys today, kind of walk through our product portfolio, talk about some other things that we're bringing to the table as a company to encourage you to place more of your Medicare Supplement business with us. I'm sure you know that the MedSup market is really competitive these days. There's a lot of carriers vying for your business. And quite honestly, the rates are pretty close together in a lot of areas all around the country. So, if we're asking for your business, we have to differentiate ourselves from all the noise out there in the marketplace. So we'll talk through some of that today. Really, if we're asking for your business, we want to make sure you know what we're bringing to the table. That way you can take advantage of those programs. A lot of those are incentive-based. The partnership that we've created with brokers, both that work in call centers and face-to-face in local communities, these are good things that you can take advantage of to grow your business. And if we can partner with you and grow together, well, that just means that everybody involved is going to be more successful, the FMO, the agent, and the insurance carriers. So really excited about that partnership. And once again, AmeriLife and Austin, thank you for putting this together so that we can do this today. Okay. So with that, we'll go ahead and get started. And if I can figure out how to work my slides here. The first thing I want to talk about before we go through the product portfolio and the mutual piece specifically is just talking about Medicare supplements in a general sense. So I like to talk about how Medicare supplements is a great door opener product. If you're new to this market, if you're new to the career, Medicare supplement, it's a great place to start. First of all, and hopefully everybody on the call knows at least this much, and that is that when someone turns 65, they enroll into the original Medicare program. That's parts A and B of Medicare. They have an initial enrollment period. So they can sign up for Medicare, and that initial enrollment period affords them an opportunity to purchase a supplement on top of the coverages provided by A and B, because there is some out-of-pocket expense, and a supplement is really there to provide exactly as the name implies. It's there to help offset the out-of-pocket expense that Medicare doesn't cover itself. Okay. Now, when they have that initial enrollment period, they have an opportunity to purchase that coverage, and they don't have to go through an underwriting process. So it doesn't matter how tall, short, heavy, skinny your client is, doesn't matter what pre-existing conditions they may have, doesn't matter what drugs they're taking. They will not get knocked out of the underwriting process because there isn't one. Okay, so you have a guaranteed solution that you can provide to all of your clients and use that to build rapport, get to know them, get that first solution in place. And even with our seniors out there, so the 65 plus crowd, there are some additional opportunities that are on the table for you. Some that pair nicely with Medicare supplement, dental insurance, final expense, cancer, critical illness coverage. There's a lot of opportunities. So even though, a lot of these individuals probably are set from an insurance perspective, hopefully they've pulled the trigger on this earlier in life, and they set themselves up for a nice retirement, and they have that nest egg that they can use to really enjoy their retirement. There are still some additional opportunities. But again, start with a Medicare supplement. It's a guaranteed solution. Build that initial rapport. Go back to that individual, a month later, 2 months later, even 6 months later. It's going to be a ripe opportunity, not just during that initial interview. Okay, so start with MedSup. Again, no underwriting is required for that first coverage when they're in their initial enrollment period, and make sure you're pivoting to some other product opportunities that you see. Okay, and this kind of dovetails nicely with that previous slide. And I'm sure everybody, even if this is your first day in the career, has heard this stat. It's almost cliche at this point. We hear it so often, but that is that 10,000 people are turning 65 every single day. That's what this bar graph is showing, broken out on an annual basis. And look, we're only, 1, 2, 3, 4, 5, 6, 7, 2019 now, 7 bars in from the left, but probably far after all of us are out of this career and enjoying retirement of our own, that number is not going to slow down. So there are a lot of people turning 65. There's a lot of people that are going to be signing up for original Medicare. They don't have to go through that underwriting process. So the opportunity within this market specifically is very large. Okay. Now we're going to pivot to the Mutual of Omaha perspective. And I put this slide together just to kind of highlight all of the options. Like I said at the beginning, there are a lot of carriers that are vying for your attention, hoping to earn a piece of your business within your book of business. And quite frankly, these are worthy competitors. Everybody is doing a lot to ask for your business. The rates are very competitive. And when we're talking about Medicare Supplement, it's a standardized product, right? If your client is looking at a Plan G, for example, it doesn't matter if they purchase that from Mutual of Omaha or Aetna or Cigna or anybody else. The benefits provided on that core product are exactly the same across the board. So why should you be focusing on one carrier over another? Well, because it's a standardized product and because it's a commodity product, a lot of that is based on price. If all things are equal, right, like that Plan G, why pay more than you have to? So we're going to show you where our rates are competitive. It's not always the same, and it's not always the same in various parts of the country. So we'll show you where our rates are really good right now. And like I said at the beginning, we'll talk through some of the other things that we're doing, the incentive and the marketing programs, the sales tools, and that type of thing. Before we get into that, though, just a quick, very brief 30-second commercial on our company. And I think this is where Mutual of Omaha really shines. Again, I've said this a couple times already, but the med sup market is very competitive. A lot of those rates are very close together. And if you see in your area, yeah.
Oh, I'm sorry. Your slides are not changing.
Oh, they're not? Okay.
No.
All right. Thank you for letting me know. Let me see if I did something wrong. Okay, how about that?
Yep, there we go.
Is that better?
Yeah.
Okay. All right. So, yeah, let me go back just to make sure you didn't miss any of this, but and I apologize, I didn't notice that, but this is that door opener slide that I talked about, making sure that you understand that MedSup's a good place to start the conversation. The initial enrollment period, when someone first turns 65, underwriting rules do not apply. Build rapport with a new client, pivot to some other product opportunities. This is that slide talking about all of the people that are turning 65. So again, just a few bars in from the left here in 2019, that number is only going to continue to increase. This only shows through 2030. That's still quite a long ways away. But again, a lot of people that are turning 65, no underwriting applies, a lot of people to talk to. And then this was just kind of that fun slide I put together showing you that there are a lot of options. A lot of carriers are vying for your business. A lot of good competition out there for us. Okay, so here's where I left off. Once again, I apologize for that. Thank you, Kaylee, for pointing that out to me. So again, this is where I think Mutual really shines, is that there are a lot of competing carriers with very competitive rates, really not too much movement or difference between those top rates. And I think this is where Mutual shines, because this is for people that are buying a Medicare supplement policy today, those baby boomers that are entering in the mid to late 60s. Those are the people that are most familiar with our company. And if you have the lowest rate in your area is ABC Insurance Company, just entered into the med sup market a couple of years ago, you don't know too much about them other than that they offer the lowest rate. Well, that may look good on the surface, but what happens 2 or 3 years down the road when they've taken a higher than expected rate increase? Can we go back to that same client and say, I can say with full certainty that I gave you the best option available at the time, and it's remained the best option through to today? That could be what you're saying, but that may not be what you're saying either. And I think the lack of certainty comes with the fact that that company doesn't have the track record like a company like Mutual of Omaha offers. We've been doing this for a long time. You can see that we're over 100 years old as an insurance company, but we've been doing med sups over 50 years when they were first offered in 1966. So Medicare was rolled out in 65. The first supplements were offered a year later in '66, and we've been in the market ever since. There are very few companies that can say that. We're a mutual company owned by our policyholders, so we don't answer to stockholders. Any dividends we pay go straight to our policyholders. We're a much more conservative-minded company, and I think we take a more mindful approach with the rates that we charge for the premiums. We want to make sure that we're keeping our policyholders, our customers, as long as we can. Again, besides MedSup, we're a full-service, multi-line provider of insurance products. So we do life insurance, long-term care, disability, annuities, critical illness, the full gamut there. So good opportunities with MedSup, and hopefully you're looking at Mutual of Omaha for those additional product solutions as well. This goes hand in hand with that previous slide. So very old company, very financially stable company. We have A ratings across the board. Again, if you're looking at that new insurance company that you've never heard of, but they have a really good rate, what are they going to be in the market in a couple of years? Are those rate increases going to stay minimal like they would with a company like Mutual of Omaha? I think that's where this comes into play. I actually pulled this straight from our website. So make sure you're sharing this with your clients. This should absolutely be a part of your sales presentation as well. And I threw this in here. Hopefully, you're nodding at your computer screen there. Hopefully it is familiar to you, but I include this in a presentation about Medicare supplements because the people that are most familiar with Mutual of Omaha, these are the people that grew up watching the Wild Kingdom on TV. For those of you that don't know, hopefully it's nobody, but there may be a few out there that don't know. This was a nature documentary style TV show that was back on in its heyday in the 60s and the 70s. In case you were wondering, it is still around. Unfortunately, it's been relegated to a YouTube series, so it's still around, but it's just on the internet these days. I guess we can blame the millennials for that, but it is still around. But again, the people that are most familiar with Mutual of Omaha, and through that, the Wild Kingdom, those are the people that are buying MedSups today. And with a competitive market like MedSup is, where we're trying to differentiate ourselves from the competition, kind of stand out from the pack, this has really done wonders for our company. So make sure you're talking that up in your sales presentations too. This slide is pretty self-explanatory. I'll let you guys read through this on your own, but I do want to highlight, I guess, those middle two bullets right there. So third one down, we're the largest agent-sold MedSup carrier, and we're the second largest carrier overall, okay? So we take a lot of pride in the fact that we have really grown as a company and developed our niche with face-to-face traditional insurance agents marketing their business in their local community, and that's where we stand out. We've grown as a company, and we've grown our distribution through brokerage. That's how you're contracted to sell our products. That's how you have access to sell our products. You have a brokerage contract with Mutual of Omaha, and that is where no one else is able to touch us. And that really should mean something to you, because everything that we're doing as a company is designed to continue to grow along that same trend. So if it's making improvements to our sales tools, like our e-application, making submitting business easier to do with our company, well, if you have a good experience there, and the policy issues quickly, that means you're going to have the coverage for your client when they need it. You're getting paid timely for that sale that you made last week. Hopefully that is a good experience, and that's going to encourage you to write more of that business with us the next time you have an opportunity when you're in front of your next MedSup eligible client, right? So if you've had a poor experience, hopefully those are few and far between. But if we're asking for your business, we have to be a good business partner to work with. So we take a lot of pride in the fact that we are the largest agent-sold MedSup carrier. The sales tools, like I just mentioned, but the incentive programs, the trips, the marketing programs that you can use to grow your book of business and be more successful, really start to grow that income, that renewal income stream. Those things are really important, and hopefully that's been a good experience with your Mutual of Omaha business. Okay, so now we're going to kind of dive into the nuts and bolts of the presentation here, and this shows what our product availability looks like across the entire country. So there's a couple things I want to point out here. First of all is the color, okay? So if you look in the bottom left-hand corner, you can see that we offer our MedSup products not just on Mutual of Omaha company paper, but we have 3 affiliates that we use as well. United of Omaha, Omaha Insurance Company, and United World. And a newer agent may say, hey, Jason, I heard everything you just said about the Wild Kingdom. You've been around for over 100 years, financially stable company, low rate increases, all that type of thing. But when I sell a mutual deal, I get the policy in the mail and I go to deliver it to my client and it says United World Life Insurance Company. That's just another hurdle that I have to jump over to ensure my client understands that they bought their policy from Mutual of Omaha. Why do you guys do that? Well, the whole idea there is that we want to keep the prices as competitive as we can make them, okay? Again, MedSup is a commodity product. Price is one of the most important factors when they make their buying decision. So we want to make sure those prices stay as low as we can. And let's take a look at Florida. Florida is a really good example. So Florida today, we offer our product on United of Omaha company paper. That product was released about, I want to say 2 or 3 years ago. I think it's been 3 now. Before that, it was Mutual of Omaha, but the price was terrible. It was something like $300 over the cheapest available in any part of that state. And even though I'm a Mutual of Omaha employee, even I would not say you need to sell a Mutual MedSup policy. I mean, the price was terrible. You're spending way more than you need to. Okay, so what we can do as a company is to close that block of business down, file a new product, use one of these affiliates here, and whenever we release new rates in a state, it'll be paper that we have not used before. And that's what you're getting with United of Omaha in Florida. We had not offered a MedSup product on United paper before. And what that means is we can be a lot more aggressive with the rates because we have no claims experience to take into consideration. And so, again, we can be a lot more competitive with the rates, and we can get back into a competitive stance when we're looking at other MedSup companies that offer lower rates than we do at any point in time. Okay, so that's why we use these affiliates for the most part, or for the whole part. Bottom line here, all of these companies are mutual companies. They're not reinsurance deals. They're not third parties. Whenever you submit an application for any of these here, that's a Mutual of Omaha underwriter that receives that application. You get paid compensation from Mutual of Omaha. All the administration, the sales tools, all of these are included in all of our incentive programs. It's Mutual of Omaha all the way. Okay, so that's the first thing to note. The second thing is either like the 12% that you see in a state like Texas or the 7% like you see in Oklahoma. This is our household discount. And again, with a commodity product where price is really important, if we can shave 7 or 12% off of the annual premium your client pays, well, that's a good thing. That's going to make us look that much more competitive. And this is one of the key ways that carriers are able to differentiate themselves. You see a 5% discount out there. You see a 10%. We do either a 7 or a 12. It's state specific, so it's not one or the other. You can choose. You can't get both. It's one or the other. It's state specific, so be mindful of that. But this is one of the ways that the carriers differentiate themselves because the amount is different, like I just said, but the way in which someone qualifies to receive it, that's different too. You could very well have a client that qualifies for a discount with company A, but not with company B. So it's important for you to understand how these work. If you're asking the right question, they say, yes, that's me. Go ahead and quote the discounted rate. That's going to give you another tool in your tool belt when you're walking through all the quotes of the companies that you represent. In just in light of time, I'm going to talk about the 12% discount just because this is offered in far more states. This is what we call a cohabitation rule. Okay, so if the applicant lives with a spouse or a domestic partner, and that's it, they can say yes to just that question, then you can go ahead and quote the discounted rate. Okay, so it's as simple as that. And it doesn't end there. If they live with someone else, so it's not a spouse, it's not a domestic partner, so some sort of non-intimate relationship, could be like a spouse, a brother or sister. They could qualify in those circumstances too. If that's what we're looking at, then we ask that the person they're living with is at least 60 years old and they've been living for at least the same, they've been living at the same address as the applicant for at least the previous 12 months. Okay, that's what the second bullet is saying right here. And then finally down here, this says that the applicant must reside with at least one but no more than 3 individuals. Why do we have these additional requirements here, the second and the third dash? Well, the whole idea behind the household discount, we want your healthy clients. People that are healthy, they're going to claim less. That allows us to offer more competitive rates for a longer period of time. And if we can tie those healthy individuals to us by discounting the premium that they pay if they purchase their coverage through our company, well, that's one way that we can ensure more of those people come our way. Okay, so that's why we do that. And here, we want to make sure the second dash right here, we want to make sure they're living with someone and they are in some sort of either a relationship or there's some sort of bond between those individuals. They could be living with someone that's, say, 25 years old. They could be a live-in caretaker. Well, that's not the healthiest individual out there if they require the services of a live-in caretaker. So we're trying to carve out those individuals from qualifying for the discount. And then the third dash, that's really talking about like a nursing home type situation. They could be living with a whole bunch of people that are at least 60 years old and they've been living together for the previous year. But if they're in a nursing home, that's probably not the healthiest individual out there either. Okay, so that's why those additional requirements are in place there. But the household discount to 12%, much more of a liberal definition than the 7%. So beyond the fact that it's going to save your client more money, it's a lot easier to qualify for it too. So make sure you're talking about the discount. If they qualify for it, go ahead and quote that discounted rate. This is showing pretty high level what our rates look like across the country. A couple things to point out. First, what we're looking at is our female rate with the discount applied in states that offer one, and it's for age 67 for the Plan G. Okay, we're very much a Plan G company. We're going to talk a little bit more about that here in just a second. But this is pretty high level again, like I said, what our rate looks like for that quoted individual. Also, it doesn't take everybody into consideration. This is a national webinar. We've probably got people dialing from all over the place. So this is really only those companies that we frequently come against the most often. Okay, so it's looking at United Healthcare, Aetna, Cigna, and Blue Cross and Blue Shield. Okay, you may have a smaller, more regional player that offers a competitive rate that's not indicative or illustrative in this map here. But again, we just kind of wanted to hit the main points, and those are the companies that we come up against the most from a competitive standpoint. So it's only looking at those. Like I just said, we're very much a Plan G company, so we offer much more competitive rates on the Plan G side of things. The rate increases on Plan G tend to be a little bit less as well. So I want to talk to you a little bit about why you may want to focus on Plan G. At least for this year, Plan F is the most popular. I'm sure you know that Plan F is going away. That's in light of the macro law that was passed a couple of years ago in 2015. It's taking effect starting January 1st, 2020. So really not that long away. It really kind of snuck up on a lot of people, I think. We're going to talk more about the impact that law has made at the tail end of the presentation. But just in terms of what we're looking at here today, Plan F is the most popular plan for good reason. There's virtually no out-of-pocket expense. If your client can afford it, why on earth would they look at anything else, right? Well, the whole idea here is that Plan G, in a lot of cases, it's not always the case, but in a lot of cases can save your client more money, even though it doesn't cover as much as the Plan F does. The one thing it doesn't is that Part B deductible. So for outpatient type services, your client goes in and gets just, let's just say a checkup or an x-ray, something where they're not admitted into a Part A facility overnight, something like that. It's just a Part B service. Well, if they have a Plan G, they have to pay that deductible first out of their own pocket before that supplement kicks in. This year, it's $185. Plan F covers that. Plan G does not, okay? Because Plan G doesn't cover that, well, it only makes sense that Plan G is a little bit cheaper, okay? And that's what this is looking at. Plan F, pretty average annual premiums here, $1,800 a year for the Plan F, about $1,200 for the Plan G. Again, G doesn't cover that deductible, so we add in that $185 to the annual premium. It's an out-of-pocket expense just like the premium itself is. So in this example, we're looking at around $1,400 a year for the Plan G total cost. versus that $1,800 for the Plan F. This is an average, or this is, in this example, annual cost savings of almost $400. Okay, so when does it make sense to promote the Plan G ahead of the Plan F? Well, you got to ask your client two questions. First of all, are they comfortable paying that Part B deductible out of their own pocket? And let's be honest, there are some people, they're going to want to purchase the Plan F. It's got fewer moving parts to it. There's less to worry about. They want to buy it and they want to forget about it, even if they have to pay more for that coverage. And that's fine. There are some people out there like that. But if they are comfortable paying that deductible themselves, and if that Plan G annual premium is at least $185 cheaper than the Plan F annual premium, that's when Plan G makes more sense, okay? And a very simple way to say it, why pay more, $185 more for something? I misspoke there. Why pay more for something when it only adds another $185 in value? Again, that's what Plan F gives you that Plan G does not, when you're going to have to spend another $385 to get it, okay? That's the Plan G value proposition in a nutshell. That's a really simple, quick one-liner sales idea to pitch the Plan G to your client. So make sure you're taking a look at that, especially after this year, because starting January 1st, and we'll talk more about this at the end of the presentation today, Plan F is going away. It will not be available for sale for anyone that becomes Medicare eligible after that date. Okay, so that's where Plan G is really going to find some additional traction. Okay, now I'm going to switch gears and talk a little bit about our value add program. So both programs that I talked about here, you can see the first one is called iMed. Pretty self-explanatory there. You can read through the offerings that it has. These are completely free programs that all of our Medicare supplement clients are automatically enrolled into. Okay, they don't have to opt in or sign up. You don't have to pay any additional premium. You don't have to quote it differently on a website. These are completely free. And the whole idea here is to add additional value like the name implies. And if they see value in them, they utilize these programs. Hopefully they hold on to their policies longer, because this is something that they get only with their Medicare supplement coverage offered through Mutual of Omaha. The whole idea here is to increase the persistency. That allows us to offer lower rates for a longer period of time. It's more profitable business for us as an insurance company. It's more renewal income for you. It's happier customers. You can focus more on prospecting for new business. So these programs are very important. So make sure you understand how they work. The graphic that you see here on the right, that's actually a screenshot of the flyer itself. It comes with the policy output. So next time you sell a mutual deal, hopefully that's soon. When you get that packet in the mail, hopefully you recognize this flyer and you can talk through it a little bit easier with your client. One thing to note here, the state availability at the bottom. So we're not picking on those states. It's just those states' Department of Insurance, they are not comfortable allowing insurance companies to offer additional programs or services beyond the core product itself. So not available in those states. So if you're marketing your business in any of those states, you sell a mutual deal, this flyer will not be in those packets. Amplifone, same sort of thing, where iMed was focused on vision-related benefits, so discounts on frames and contacts and eye exams. This is focused on hearing, okay? So first of all, hearing aids can be really expensive, right? Well, if they get a quote from a third party, they take it to Amplifone. Amplifone's going to match that, offer an additional discount of 5%. Risk-free trial for 60 days. So if they get some hearing aids, they decide they don't like them, send them back, they're going to get their full refund back. So risk-free trial for 60 days. Free batteries for a couple of years. And in this one, you can actually cut, again, this is the flyer that comes with the policy output. This is a coupon you can cut out of the flyer, and I need to update this bullet. So this says $50 off of one hearing aid or $125 off of two hearing aids. So there is up to $125 of additional savings on top of the 5% discount that they're going to get with the price match. State availability on this one is the same. Switching gears again and talking about our incentive offerings as a company. So we're doing a lot to encourage your business. The first thing I want to talk about is our annual incentive trip that we do each year. Mutual Sales Leaders is the name of that one. So hopefully you've seen it through correspondence on the website. Other agents in the office talk about it. This is really a great opportunity for us to get in front of our top producers thank them for a year of hard work, and hopefully earn their business for years to come. We do a really nice one from a competitive standpoint. I've heard, and maybe this is just people telling me what I want to hear, I don't know, but I've heard that we do one of the nicest trips in the industry, and this is something that we're very proud of as a company. So hopefully you've been in there before, or if you haven't, hopefully we'll see you next year. We're going to London, which is really exciting. You can actually qualify for this a number of different ways. Simplified health, so that's the priority income protection or cancer, heart attack, and stroke product. You can also qualify with our simplified issue life portfolio, so term life express, final expense, children's whole life. But since we're talking about MedSup today, I just want to talk about the MedSup requirements. You need 275,000 production credits. What's a production credit? It's essentially $1 of annual premium when you sell a MedSup policy. So average case size on a MedSup is about $1,500. So if you sell one policy, you're going to get $1,500 on your way to $275,000. Okay, so it's about, whatever that is, north of 200. I don't know the exact math. We increased the requirement this year, so it used to be about 175. I'm sure it's a little over 200 now, just because London's a pretty pricey destination, and that's just kind of the trend that's happening with the production that we're seeing. You can also write the dental. So I mentioned at the beginning that MedSup's a great door opener product. There's a lot of great ancillary sales to make along with the MedSup. Probably the best one to do is dental, just because Medicare doesn't cover most dental services, and if Medicare doesn't cover it, supplement's not going to be covered either. Your client has to have a standalone dental insurance policy. We have a great portfolio that we just released a couple years ago. So sell a dental with your MedSup, you're going to qualify for this trip twice as fast, because you're going to get one credit per issued dollar of premium with a dental policy as well. The next one I have is marketing credits. So this is a pretty cool program. As far as I know, we're the only company that offers something like this. This is money that you can use to reinvest back into your business. So here's how this one works. If you write at least 5 MedSups in a month and you're using our e-application, we're going to take a look at that annual premium figure like I was just talking about on the last slide with our trip. Take 1% of that annual premium, and we're going to give you marketing credits. It's essentially money, dollars, that you can use for marketing-related expenses. So lead reimbursement, if you want to do like a mail campaign, you can use marketing credits to reimburse yourself for postage. If you want to order anything from our company collection store, so that's like, brochures, small gift items, golf balls, you want to take a client golfing, pens, you want to buy a nice leather portfolio, something like that, you can use marketing credits for a wide range of things. 1% for e-app business. If you're using paper apps, you can still get marketing credits there, but we try to push people to our e-app. It's just a more efficient, lower cost way to do business. But if you do paper apps, we're not going to not incentivize you for that. You're just going to accumulate the marketing credits at half the rate, so 0.5% for paper apps. They do accumulate month to month, but they ultimately expire. They only expire once per year. This year, they're going to expire on November 30th, okay? So make sure if you have a marketing credits balance, you use all of them before that date, and then we're going to start over starting on December 1st. And then the last one I have here is our broker bonus program. So this is a pretty straightforward cash for apps program. So it works a lot like the marketing credits. You got to write 5 in a month to qualify, and then once you hit your 5 minimum threshold, we're going to pay you $150 for an underwritten application and $30 for an open enrollment application. So at the beginning of the call, I talked about the initial enrollment period. If you sign someone up for a MedSup while they're in that initial enrollment period, that's in an open enrollment app, okay? And then if you're talking to someone, let's say 5 years down the road, they took a few rate increases, they're still healthy enough to move, and you want to replace their current coverage with that from another carrier, they could still get the same plan, so no disruption in benefits, no change in benefits. The whole idea there is just to lower their rate, but if they do that, their enrollment period has probably ended, especially in this example, especially for 5 years down the road. They have to go through an underwriting process. So if you write one of those deals, you're going to get paid $150 for that one, okay? This only pays on F, G, and N. Again, only underwritten in open enrollment applications and only in the states that you see listed here. We're likely going to extend this through the entire year, but the current version of this program is set to end on June 30th. So make sure you take advantage of this program through the summer. And here's my slide on MACRA. So for those that aren't familiar with what's going on, MACRA stands for the Medicare Access and Chip Reauthorization Act of 2015. Quite a mouthful, right? So we just call it MACRA. And all this means is people that are newly eligible to Medicare, so they turn 65 either on or after January 1st of 2020, they will not be able to purchase a MedSup plan that covers the Part B deductible. In parentheses, you can see that includes Plan C, F, or high deductible Plan F. Some people are asking what's the rationale behind this law? Well, the whole idea here is more patient accountability, okay? If you have a plan like the Plan F that provides nearly complete coverage, Plan F does, they cover everything, including the Part B deductible. It's called first dollar coverage. Well, there are some people out there that think if your client has a Plan F and they have to pay nothing for any of the services that they're going to go into a medical facility to receive, they may use that more than they should. Okay, they could have a hangnail or a bad headache and say, you know what, I want to get my money's worth. I'm just going to go into the doctor, get it checked out. Could be worse than I thought. And I have my Plan F, so why not, right? Well, a lot of people think that puts undue strain on insurance companies, on the healthcare system. And so as a result, they passed this law a few years ago in Congress, and those plans are no longer going to be available for those that are newly Medicare eligible. If you have a client that has a Plan F today, they don't have to worry about it. Some people think that Plan F is going away for everybody. Like the policy is going to get canceled and they're going to have to reapply. That's not the case, okay? If you have a client today that has a Plan F, that will still continue to work like it always has. If you've had someone that was Medicare eligible before this date, so they turn 65 tomorrow, they're going to purchase a Plan G to start. But after that goes in force and they decide they don't like that and they want to purchase a Plan F, even after January 1st of next year, they still can. If they were Medicare eligible before January 1st, they still can purchase a Plan F. Okay, so once again, it's only for those that turn 65 after January 1st of next year. And then the other thing I should point out here, I'm just kind of reading through the slide, at the bottom there, because the high deductible Plan F is going away, a lot of insurance companies, and we're included here, they're rolling out a high deductible Plan G. Okay, so that's not going to be available for purchase until around July-ish timeframe, just because in most states you can write 6 months out from the effective date. The effective date will not become an option until January 1st of next year when the law takes effect, but that will be another option that you can add into your portfolio as well. So the high deductible Plan G works just like the regular Plan G does, except there is that deductible before any benefits kick in. I believe that deductible amount is the same as the high deductible Plan F offers today. It's around $2,300, okay? And then just so you know, we have this flyer that we created. You can download this from our agent portal, Sales Professional Access. So it's a quick guide on the MACRA law. So it covers a lot of the stuff I just mentioned, who's impacted, who's not, what you have to do as an insurance agent. Really good information for you to have. I'd imagine you're getting phone calls. If you're not yet, it'll probably happen pretty soon as more public communications are released out in the public realm, so on websites, on commercials, on TV, all that type of thing. So arm yourself with the information. It's an additional way that you can add great value to all of your current customer relationships and those new prospects that you're trying to get in front of, okay? Oh, and there you go. I forgot I zoomed in on it. So that's a better look at it. Once again, you can download this from the website, and we'll make sure that AMG has a copy of the presentation so they can distribute it to everybody that was on the call today, okay? So I know I probably went longer than you were hoping. Hopefully it was good information. I'll see if there's any questions on the line, but once again, my name is Jason, That's my office line there and my email address. So if you have any questions on any of the content you saw today and you can't think of a question right now, shoot me an email or give me a call later and we can chat over the phone or via email. Okay? But with that, I'm going to turn it back over to either Caitlin or Austin, and we'll see if there's any questions that we can answer right now.
Hey, it's Austin here. We only had the one question from Lee Green. He also has left now, but it just said, so if your spouse is under 60, then you don't get the discount, talking about the household discount there.
No, that's not true. If so, on the 12% discount, if the applicant is married, then they will qualify for that discount. The 60-year-old age requirement, that's only in play if the applicant lives with someone other than a spouse or a domestic partner. So the example I use is a brother or sister. It could be anything. It could be a friend.
Right.
If they live with someone other than a spouse or domestic partner, then we add those two additional requirements: 60 years old, living together for the previous 12 months. Okay, if it's a spouse or domestic partner, that's all there is to it, and they can go ahead and quote the discounted rate.
Excellent, excellent. Lee also said that Plan F is not going away. It is simply being closed out to new enrollments.
Yeah, that's correct. Yeah, once again, with that macro law, it's only for those that are Medicare eligible after January 1st of next year. If you have a client that has the Plan F currently or is Medicare eligible prior to that date, that will still be available for purchase even after January 1st of next year.
Perfect. That's the only two questions
Okay.
that I got here.
Okay, perfect. Well, once again, thank you everybody for your time. Have a good week, and we'll talk to you soon. Okay? Thank you.
Thank you, Jason.
Yep, thank you.